than half of U.S. adults take supplements for weight loss and mood boosts. However, now there is growing evidence suggesting supplements account for 20% of drug-induced liver injuries. It's according to National Geographic. So joining us now is Dr. Ann Huang with HCA HealthOne Transplant Center. Thanks so much for joining us today.
No, thank you so much.
Okay, so I have lots of questions for you, but people, they've been taking supplements for decades.
Right.
So now why do we see this huge spike?
I think there's a lot more recognition in terms of identifying patients who, if their liver enzymes go up, going back and trying to figure out, okay, have they started taking something? And I also do think the supplement market has really increased quite a bit. I mean, everyone wants to find something that's going to make them feel better, get healthier. It's actually a huge market, especially in the U.S., and I think especially here in Colorado. But, I think when you talk about what patients want to do, they want to be more natural, but natural does not necessarily mean harmless.
Yeah, you're right. It seems like at the store, there's something for everything, right? When should we be aware of the supplements we take?
So I do think that if you have a discussion about any sort of supplements, I would talk to your physician about it or a provider, because, not only do you take a medication that is actually processed through the liver, other medications may actually interact with them. So I think it's really important to identify which medications or any sort of supplements, is it really going to be beneficial? What is the data that's out there? Because I think a lot of people will take supplements after talking to their neighbor, talking to their family, they've seen something on the internet. I would love to take something that would automatically make me healthy as a 20-year-old, but I do think there's a lot of drug-drug interactions that can happen.
So definitely consult with your doctor first.
Correct.
Before deciding which one you're going to take.
Yes.
Okay, so is there a good balance with taking extra supplements, or should we avoid them altogether?
I mean, I don't think it's necessarily a bad thing to take supplements. When you talk about drug-induced liver injury, there was a multi-center coalition that actually studied these patients, and it's actually translated to, there's a website where people can look it up. It's called Liver Tox, and it's actually through the National Library of Medicine. It is a website that I utilize a lot because when patients come in, they may be on a new medication. It actually lists medications, kind of what the potential hepatotoxicity or liver toxicity is. And it also gives something called a likelihood score, which gives the possibility of having problems with liver problems. So the likelihood score goes from an A, which is very likely, to an E, which is unlikely. And yes, everyone talks about supplements, but the most common group of medications that causes liver or drug-induced liver injury is actually antibiotics. And so medications like Augmentin, Cipro, nitrofurantoin, those actually all cause it. Now, every patient may not necessarily have a problem. It's kind of like having a penicillin allergy, where some people will actually be able to take it and some people won't. But it's really hard to figure out which patients may be susceptible.
Okay, you really have to be careful.
Right.
Dr. Huang, thanks so much for coming on the show.
No, thank you very much. I appreciate the time.
Yes, all important information. And remember, you can watch all of our interviews on our website, cbscolorado.com. We'll be right back.